So a lot of times when we take care of knee pain, we're always trying to find the location. If we can find the location, then we can many times find the damaged tissue, and then we can ultimately figure out the right things to correct that tissue, right? Or that tissue damage. So we're going to go on the lateral side. On other videos, we've talked about patellar tendonitis and lengthening the quad, etc., because those are usually, not always, but those are usually your younger patients, your more active folks. But also what can happen as we age is even as young, but you usually don't become arthritic, you can get inflammation underneath the kneecap. So that kneecap almost becomes so tight. It's, at least in my experience, you can imagine, because again, that kneecap floats and then there's muscles attached to it. And so what'll happen is you have that quad muscle that's down here, and then you have that patellar tendon down here. So you have things that are physically attached here and here, above and below, and if they're tight, they're gonna pull that kneecap back towards that femur head. Or femur head's up there. So what are we gonna do? What do we need to do? So one, if it's been there for a long time and you notice there may be some arthritis in there, okay? If you get a side view, you'll see jagged edges, you'll see where the kneecap starts to point at the top, and just becomes a problem, obviously. And so what do you need to do? Well, you need to release that quad muscle for one, because again, you have to create slack so that you're not just constantly smashing that kneecap up against your femur, but also too, you may have to get behind here in that subpatellar space and behind the patella and get something in there. So we've used things like PRP, etc., and had great success with that, but it was also because we were treating the area above and below the muscles, etc., and lengthening that tissue. Okay, so we want to decrease the inflammation here. If there's already arthritis, I don't suggest using steroids if you can prevent from using them, because they are going to make that arthritis worse. Even if it helps it feel better, they will still make it worse. So things like platelet-rich plasma, amniotic fluids, regenerative medicine techniques, etc., ozone, whatever. Those are things that I would go after first, so that you can save that tissue, hopefully even help that tissue heal a little bit, and while you're trying to decrease the inflammation so that you can decrease the pain. So again, that knee pain where it's right in the front, you push down your kneecap when your knee is straight, you feel quite a bit of pain, there's inflammation underneath the kneecap, lengthen the tissue above and below, and then also if you need to get below there and put some sort of anti-inflammatory, use something that is not going to make the arthritis worse.